Is there a time bomb hiding inside your body? No pain, no clear warning signs, and yet, day after day, it silently damages your heart, brain, kidneys, and blood vessels until it triggers a sudden stroke or heart attack. This time bomb is high blood pressure, often called the silent killer, and millions of Americans may be living with it without even knowing. So, why is high blood pressure so dangerous? How exactly does it affect your body, and more importantly, what can you do to control it before it's too late? In today's video, we'll break down the truth about this condition and show you how to avoid becoming its next victim. What makes high blood pressure so dangerous? High blood pressure, or hypertension, earns its title as a silent killer for one simple reason. It often causes no obvious symptoms in its early stages. A person may feel perfectly fine, while dangerously high pressure is quietly damaging their arteries and increasing their risk for stroke, heart attack, heart failure, kidney damage. Even more concerning is that many people, especially older adults, African Americans, and Asian Americans, underestimate the severity of this condition. They may have heard of high blood pressure. Some may even take medication regularly. But just one moment of neglect, skipping a blood pressure check, eating too much salt, or letting stress pile up, can send them into a medical emergency. Understanding the true nature of hypertension is one of the most important foundations for taking charge of your health, especially after age 50. Right now, let's dive into 5 shocking but essential facts about high blood pressure. Truths that may change how you view cardiovascular health and potentially save your life, or someone you love. Let's begin this journey of understanding to prevent, before it's too late. Why just one number isn't enough. One of the most common and dangerous misunderstandings goes like this: my blood pressure was 120, so I think I'm okay. It might sound reassuring, but without the second number, this reading tells you almost nothing. Consider this. A reading of 120/95 mmHg signals isolated diastolic hypertension, a red flag that shouldn't be ignored. Meanwhile, 120/75 mmHg is perfectly normal and healthy. These two numbers, systolic and diastolic, are equally important. Systolic pressure, the top number, shows how hard your heart is working to pump blood through your body. Diastolic pressure, the bottom number, reveals the pressure in your arteries between heartbeats when your heart is resting. If either number, or both, stays elevated over time, it could be a strong predictor of future heart problems, vascular disease, and stroke. A key truth about blood pressure: it's not just a static number. One important point to remember: your blood pressure isn't fixed. It can fluctuate throughout the day, depending on physical activity, emotional state, posture, or even the time of measurement. A single elevated reading, especially in a setting that makes you anxious, like a doctor's office, doesn't automatically mean you have hypertension. This is known as white coat hypertension, and it's surprisingly common. However, if your readings stay elevated while you're at rest across multiple measurements or home monitoring sessions, that's when concern is warranted. That's why doctors typically don't diagnose hypertension based on one reading alone. They'll repeat measurements at different times or recommend home monitoring to get a more accurate picture of your baseline. Understanding these numbers and keeping a close eye on them is one of the first and most critical steps to protecting your long-term heart health. Truth number 2: blood pressure is not just good or bad. It exists on a spectrum. Knowing your blood pressure numbers is just the beginning. What really matters is understanding where those numbers fall on the cardiovascular health spectrum. According to the American Heart Association, AHA, and the American College of Cardiology, ACC, blood pressure isn't simply categorized as normal or high. Instead, it's divided into clear stages, each reflecting a different level of risk and requiring a different approach. Ideal blood pressure: less than 120/80 mmHg. This is the gold standard, the range most strongly associated with the lowest risk for cardiovascular disease. For example, 110/70 mmHg is considered ideal. normal blood pressure. Systolic 120, 129 mmHg. Diastolic 80 to 84 mmHg. Still within the safe range, but if you're near the upper limit, it's crucial to maintain a healthy lifestyle to avoid drifting into a higher risk zone. Elevated prehypertension. Systolic 130, 139 mmHg. Or diastolic 85 to 89 mmHg. This is a warning zone, an early signal that you're at higher risk of progressing to full hypertension if you don't change your habits. People with additional risk factors like diabetes, kidney disease, or a history of stroke should be especially cautious. At this stage, diet changes, exercise, and stress management become urgent priorities. In some cases, doctors may even consider early medication intervention. Think of this as the body's yellow light. It's telling you to slow down and redirect before serious consequences follow. Hypertension, high blood pressure, consistently 140/90 mmHg or higher. Some updated guidelines even set the threshold at 130/80 mmHg to identify stage 1 hypertension earlier and prevent long-term damage. Hypertension is also graded by severity, depending on how high the numbers are and how likely they are to cause complications. Stage 1. Hypertension, the early red flag. You shouldn't ignore. At this stage, blood pressure typically ranges from 130 to 139 mmHg systolic or 80-89 mmHg diastolic, according to updated guidelines from the ACC/AHA. Some older references still use 140 to 159 systolic or 90-99 diastolic for stage 1. Whichever standard is used, this level of blood pressure signals the start of cardiovascular risk. Lifestyle changes become non-negotiable, including reducing salt intake, increasing physical activity, managing weight, and reducing stress. If a person has additional risk factors such as diabetes, high cholesterol, a history of stroke, or kidney disease, doctors often recommend starting medication alongside lifestyle changes to protect the heart and blood vessels from further damage. Stage 2. Hypertension, when things get serious. This is a more severe stage where systolic pressure reaches 140 mmHg or higher, or diastolic is 90 mmHg or higher, based on newer guidelines. According to older classifications, this stage is marked by readings of 160-100 mmHg or higher. At this point, the risk of damage to the heart, brain, kidneys, and blood vessels rises sharply. Most patients at this stage will require prescription medications, often from 2 or more drug classes, in addition to strict lifestyle adjustments and regular monitoring. Ignoring this stage can lead to life-threatening complications. Hypertensive crisis, a medical emergency. When blood pressure suddenly spikes to over 180 mmHg systolic and or 120 mmHg diastolic, 180/120 mmHg, it is considered a hypertensive crisis, a true medical emergency. This condition can cause acute organ damage, and immediate emergency care is essential. If not treated promptly, it can result in a heart attack, stroke, kidney failure, or even death. Know where you stand, not to scare you, but to empower you. Understanding exactly where your blood pressure falls on this spectrum isn't about labeling or causing panic. It's about helping you and your doctor build a personalized strategy to protect your heart and long-term health. Truth number 3, the real danger lies in the silence. Why hypertension is called the silent killer. What makes high blood pressure so dangerous is not that it causes immediate pain, but that it often causes no symptoms at all for years. All the while, it silently damages your blood vessels, strains your heart, and raises your risk of stroke, heart attack, kidney failure, or even vision loss. This quiet nature is why hypertension is known as the silent killer. You might feel perfectly healthy, but beneath the surface, pressure is mounting, like a ticking time bomb. Because symptoms are often absent, routine blood pressure monitoring is critical. Waiting for symptoms to appear before checking your blood pressure is a dangerous gamble. Warning signs. When they do appear, usually too late. In some rare cases, when blood pressure becomes dangerously high, symptoms may emerge. These include severe or unusual headaches, dizziness or lightheadedness, sudden nosebleeds, shortness of breath, blurred or impaired vision, chest pain, confusion, or altered mental state. But make no mistake, these signs typically show up in late-stage or emergency scenarios when irreversible damage may already be underway. That's why relying on how you feel to determine your blood pressure status is risky and unreliable. How to stay in control. The only reliable way to know if you have high blood pressure is through regular monitoring, either at your doctor's office or at home using a validated device. Adults should check their blood pressure at least once a year, and more often if they have a history of hypertension, diabetes, heart disease, or other risk factors. Early awareness is your best defense in the fight against this silent killer. Truth number 4. Long-term battle. Managing high blood pressure is a lifelong journey, not a quick fix. For most people diagnosed with hypertension, especially those requiring medication, managing the condition isn't a matter of a few weeks or months. It's a long-term commitment, often lasting a lifetime. This can feel confusing, especially when someone feels perfectly fine and doesn't experience any noticeable symptoms. But it's essential to understand that blood pressure medications don't cure the disease. They're used to keep your blood pressure in check, reducing the risk of dangerous events like stroke or heart failure. There are several classes of medications used to treat hypertension. Some relax the blood vessels, such as ACE inhibitors, angiotensin receptor blockers, ARBs, and calcium channel blockers. Others help the body eliminate excess sodium in water, diuretics, while beta blockers slow the heart rate and reduce cardiac output. Each class plays a role in controlling blood pressure, but only if taken consistently and as prescribed. A common and dangerous mistake is stopping the medication once blood pressure returns to normal. Many believe they're cured, but in reality, stopping medication can trigger a sudden rebound in blood pressure, sometimes higher than before. This is known as rebound hypertension and can lead to heart attacks or strokes. Hypertension is a chronic condition, much like diabetes. Just as people with diabetes must monitor blood sugar for life, those with high blood pressure need continuous management to protect their heart and vessels. Treatment may require dose adjustments, changes in medication, or a combination of drugs, all of which demand close communication with your doctor. Even with medication, a healthy lifestyle remains the foundation for effective control. Diet, exercise, stress management, and regular monitoring are non-negotiables in this lifelong journey. Truth number 5. The domino effect. High blood pressure silently attacks the whole body, not just the heart or brain. When we talk about complications of hypertension, stroke, and heart attack are often the most feared, and for good reason. But in truth, the damage caused by uncontrolled high blood pressure extends far beyond these two outcomes. It affects multiple organ systems, often silently and severely. Blood vessels. Hypertension accelerates atherosclerosis, the buildup of plaque in arteries, which narrows and stiffens blood vessels. This limits blood flow and increases the risk of blockages. High pressure also weakens artery walls, raising the chance of aneurysms, bulges in vessels that can rupture without warning, sometimes fatally. Heart. To push blood through narrowed vessels, the heart must work harder. Over time, this causes the left ventricle to enlarge, left ventricular hypertrophy, reducing the heart's pumping efficiency and leading to heart failure. Narrowed coronary arteries also increase the risk of angina and myocardial infarction, heart attack. Brain. The brain is highly sensitive to changes in blood flow. Hypertension is the leading cause of both ischemic and hemorrhagic strokes. It also contributes to transient ischemic attacks, TIAs, warning signs of future strokes, and increases the risk of vascular dementia due to chronic brain ischemia. Kidneys. The kidneys rely on a fine network of capillaries to filter waste. High blood pressure damages these vessels, reducing filtering ability and causing chronic kidney disease, sometimes leading to dialysis or the need for a kidney transplant. Eyes. The retina contains delicate blood vessels that are easily damaged by elevated pressure. This leads to hypertensive retinopathy, which can cause blurred vision, eye hemorrhages, or even permanent blindness. The optic nerve may also be compromised. Sexual function. Adequate blood flow is essential for sexual health. High blood pressure can impair circulation to the genitals, leading to erectile dysfunction in men and reduced arousal or satisfaction in women. This system-wide impact is a clear warning. Managing blood pressure isn't just about preventing a stroke. It's about preserving your entire body from long-term, irreversible harm. The solution? Accurate knowledge, consistent, healthy habits, and a strong partnership with your healthcare provider. That's how you stay in control of your future, one heartbeat at a time. Take control, knowledge, lifestyle, and medical partnership. Understanding the 5 hard truths about high blood pressure isn't meant to scare you, it's meant to empower you to take action. Yes, hypertension is serious, but with the right strategy, it is absolutely manageable. And it all starts with 3 core pillars: regular monitoring, healthy lifestyle changes, and close collaboration with your healthcare team. 1. Know your numbers. Keeping track of your blood pressure is non-negotiable. If possible, invest in a clinically validated home blood pressure monitor so you can measure it in a calm, familiar environment, reducing white coat hypertension. Make sure you're doing it correctly. Sit calmly for 5 minutes before measuring. Sit upright with feet flat on the floor. Don't talk during the reading. Use a properly sized cuff for your arm. Log your readings to track progress over time. 2. Make lifestyle changes that stick. Daily habits form the foundation of both prevention and long-term control. Eat smarter. Follow the DASH diet, rich in vegetables, fruits, whole grains, lean protein, and low-fat dairy. Cut back on sugar and unhealthy fats. Cut the salt. Limit sodium to under 2,300 milligrams per day, ideally below 1,500 milligrams if you're already diagnosed with hypertension. Avoid heavily processed foods, canned items, and salty restaurant dishes. Boost potassium intake. Potassium helps balance the effects of sodium. Load up on bananas, potatoes, leafy greens, beans, and yogurt. Move more. Aim for at least 150 minutes of moderate activity per week. Brisk walking, swimming, cycling, plus 2 sessions of strength training. Watch your weight. Losing even 5 to 10 pounds can significantly lower your blood pressure if you're overweight. Limit alcohol. No more than 1 drink per day for women, 2 for men. Ditch smoking. Quitting smoking doesn't just lower your blood pressure, it drastically reduces your overall heart disease risk. Manage stress. Try deep breathing, meditation, yoga, journaling, or simply walking outside. All of these can naturally lower blood pressure. 3. Work with your doctor. Don't go it alone. No one manages high blood pressure entirely on their own. Partner with your doctor. Share your health history, discuss your readings, and stick to your medication plan if prescribed. Never adjust your dose or stop taking medication without medical guidance. If you experience side effects, let your doctor know right away so they can make the proper adjustments. The bottom line. Controlling blood pressure isn't something you do in a week or a month. It's a lifelong journey of knowledge, consistency, and partnership. But the reward is priceless. A healthy heart, a full life, and a sustainable future. Final thoughts, and a call to action. High blood pressure may be a silent enemy, but with the right understanding and proactive attitude, you can take control and reduce its impact on your health. Don't let this condition quietly chip away at your body from the inside. Start today. Monitor your blood pressure regularly. Eat smart, move daily, and manage your stress. Stay in close contact with your healthcare team. By doing so, you're protecting your heart, brain, kidneys, and your life. Act now, no matter your age. Whether you're 30, 50, or enjoying retirement, blood pressure control matters. Frequent checks, smart eating, regular movement, and medical guidance won't just help you live longer. They'll help you live better. We want to hear from you. Do you have questions about high blood pressure? Have you or a loved one experienced something that could help others? Share your story in the comments below. A single comment could make a big difference for someone in our community. Thank you for watching. Wishing you and your loved ones a strong heart, steady numbers, and a positive spirit every single day.